Hello everyone, I am Dr. Monu Singh, Senior Consultant Orthopedic Surgeon and Chief of Services for Joint Replacement, Arthroscopy and Sports Medicine at Narayana Super Speciality Hospital, Gurugram. Friends, today I just want to give a few general tips about keeping healthy knees. Knees, we all know, are a very important structure for all of us. We have to move around, jump around, run, so many things. Most of our social activities, squatting, sitting cross-legged, all our sporting activities, everything requires a healthy pair of knees. But so often, as we Indians are prone because of our social habits and also genetic makeup, we tend to wear out our knees over a period of time with our activities. So how do we keep these knees healthy so that we do not suffer from osteoarthritis or wearing out of the knee at a later date? There are a few general tips which I would like to share with you people today. So knee is a weight bearing joint. It is a joint when we stand and walk where all the weight is being transmitted to the bone. The weight bearing joints, it's like a machine. They are prone to wearing out, and they are prone to wearing out if we put too much of stress on them. So the basic idea of preventing an arthritic knee from happening or occurring is we have to reduce the stress on the knee joint, and we have to improve the muscle which is balancing that joint, the muscle coverage around that joint. It has to be kept in a healthy manner. It should be strong enough to support the joint, to prevent any stresses which are occurring onto the joint, and we have to reduce the stress. So the mismatch of increased stress and low muscle strength around the joint, it has to be changed into a joint with a healthy muscle group around it and very little stress on the knee joint. So for all that, very few things, there are a few simple tips and tricks which are required for all this, and most important one in them is not to squat. You see, when we are squatting, when we are sitting down on the ground and getting up from that position, there are two things which are happening. A, our knees are in the extreme range of motion, and from that extreme range of motion, as with the fully bent knee, when we are getting up, we are putting a lot of stress on that knee joint. Almost about 3 to 5 times the body weight is being put onto that joint when we are getting up from that sitting position, and that too in the extreme range of motion. So what that causes is a lot of stress on the cartilage of the knee joint, and it results in a micro trauma or a damage with over a period of time. It can lead to happening of osteoarthritis. The second activity that we should be careful about is taking stairs. Now, taking stairs is a very healthy habit supposedly, but for the heart, not for the knees. If we are going upstairs and carrying weight along with us, then whatever weight that we are carrying is going to be transmitted to the knee joint. All that weight is going to add up to my body weight, and we are going to be placing it on the knee joint. So when we are taking stairs, we should ideally try and avoid lugging up heavy luggage or anything heavy. We should not be carrying heavy weights when we are taking stairs, going upstairs. And as a rule, you should try and take the stairs only if it is possible for you to do so without causing a pain or a stress on the knee joint. So these two habits, they help in reducing a lot of risk factor associated with an early development of osteoarthritis of the knee. But now we come back to the sporting activities. A lot of people in their middle ages, the weekend warriors who would like to go out and play on the weekends, and the whole week they are working, they are the ones who are very much prone to developing injuries of the knee while playing football or hockey or cricket. So how to stop all these injuries from occurring? It's very simple. You must do a proper warm-up. You must stretch out all your muscles. You must spend a few minutes, 5 to 10 minutes, in trying to let the muscle adjust to the range of motion and to the sudden burst of fitness, the sudden burst of physical activity which is required. You have to warm these muscles up. So a few minutes should be taken with that. You have to do a little bit of stretching, and you have to make sure that when you are playing, that your hydration should be good. You should be having a very good hydration, otherwise a dehydrated muscle is liable to cramp and have injury. It's more likely with these muscles in a dehydrated state. Also, for those who are actively into sports and are inclined to practice almost every day, they should have a schedule where they should take a break in between. You should never be practicing daily, but you should have a schedule with a break in it, so that the muscles, they are able to recover from the physical activity or whatever micro trauma which is happening. You should take plenty of vitamin C in your diet. Helps in the healing of the cartilage, healing of the muscular tissues, and it is always better to maintain a good posture. Even when we are lifting up things, we should try and hold up things closer to our body and not hold them out. We should bend our knees, keep our back straight, and then pick up things. When we have to get up from a sitting position, as if after a long sitting or from a car ride, let us say, one should not immediately get up and start walking, but before getting up, move your knees a little bit, 3-4 times. The lubrication of the cartilage becomes better, so that when you are loading your cartilage, when you are loading your knee joint and getting up, the damage is much less. Also, when you are working, you must keep shifting your weight. You must keep shifting the weight from one side to the other side. Do not be very much static all the time when you are standing and working. You should bend your knee a little bit, give it rest, go on to the other knee, shift the weight. So simple, these are simple methods of preventing a knee damage in a long run. And if we are able to stop squatting and avoid stairs and do simple knee strengthening exercises, then most of the work is already done. And that is what we should strive to do. So happy knees, everyone.